1. What is the priority nursing action for a patient experiencing shortness of breath and decreased oxygen saturation? A. Apply oxygen via nasal cannula at 6 liters per minute. B. Place the client in high Fowler's position. C. Encourage deep breathing every 4 hours. D. Suction the airway immediately. Answer: B. Place the client in high Fowler's position. 2. A nurse notes continuous bubbling in the water seal chamber of a chest drainage system. What should be done first? A. Notify the healthcare provider. B. Reinforce the chest tube dressing. C. Milk the chest tubing every hour. D. Clamp the chest tube. Answer: A. Notify the healthcare provider. 3. A client with COPD is short of breath. What action should the nurse take first? A. Administer oxygen at 2 liters per minute via nasal cannula. B. Encourage the client to cough and deep breathe. C. Position the client supine to promote drainage. D. Withhold fluids to prevent aspiration. Answer: A. Administer oxygen at 2 liters per minute via nasal cannula. 4. Which intervention helps prevent ventilator-associated pneumonia? A. Suction the client every 30 minutes. B. Turn and reposition the client every 2 hours. C. Lower the head of a bed during feedings. D. Limit oral care to once per shift. Answer: B. Turn and reposition the client every 2 hours. 5. Which client should the nurse assess first? A. Assign to an LPN for continuous assessment. B. Assess the client first before making other rounds. C. Delegate to a UAP to measure oxygen saturation. D. Wait until morning rounds to reassess the client. Answer: B. Assess the client first before making other rounds. 6. Which intervention is most effective for liquefying respiratory secretions? A. Use humidified oxygen. B. Administer a cough suppressant. C. Place the client in Trendelenburg position. D. Restrict fluids to prevent overhydration. Answer: A. Use humidified oxygen. 7. Which assessment finding is most consistent with an asthma exacerbation? A. High-pitched wheezing on expiration. B. Decreased breath sounds in both lungs. C. Presence of crackles in upper lobes. D. Rhonchi that clear after coughing. Answer: A. High-pitched wheezing on expiration. 8. Which instruction should be included in the care plan for a client with pneumonia? A. Encourage the client to rest flat in bed. B. Instruct the client to use incentive spirometry hourly. C. Restrict fluid intake to reduce secretions. D. Apply a cool mist humidifier. Answer: B. Instruct the client to use incentive spirometry hourly. 9. Which task is appropriate for the nurse to delegate to a UAP for a patient on oxygen therapy? A. Instruct the UAP to reposition the client. B. Ask the LPN to auscultate breath sounds. C. Delegate oxygen titration to the UAP. D. Assign assessment of respiratory status to UAP. Answer: A. Instruct the UAP to reposition the client. 10. A client's oxygen saturation suddenly drops from 95% to 84%. What is the nurse's initial action? A. Turn off the oxygen to check equipment. B. Ask the client to take deep breaths. C. Replace the oxygen tubing immediately. D. Check oxygen connections and pulse oximeter placement. Answer: D. Check oxygen connections and pulse oximeter placement. 11. What is the appropriate oxygen target range for a client with chronic hypercapnia due to COPD? A. Use a non-rebreather mask for oxygen delivery. B. Avoid oxygen therapy to prevent CO2 retention. C. Maintain oxygen saturation between 88% and 92%. D. Administer high-flow oxygen at 15 liters per minute. Answer. C. Maintain oxygen saturation between 88% and 92%. 12. Which finding indicates a possible pneumothorax in a client with blunt chest trauma? A. Decreased oxygen saturation. B. Decreased breath sounds on the affected side. C. Midline trachea. D. Symmetrical chest expansion. Answer. B. Decreased breath sounds on the affected side. 13. Which respiratory finding is most concerning and requires immediate action? A. Crackles in the lung bases. B. Wheezing during inspiration. C. Absence of breath sounds in one lung. D. Bronchial breath sounds over peripheral lung fields. Answer. C. Absence of breath sounds in one lung. 14. What is the priority step when preparing for suctioning a tracheostomy client? A. Auscultate lung sounds before suctioning. B. Apply suction while inserting the catheter. C. Limit suctioning to 30 seconds each pass. D. Pre-oxygenate the client before suctioning. Answer. D. Pre-oxygenate the client before suctioning. 15. What is a key measure to prevent aspiration pneumonia in a client with dysphagia? A. Encourage coughing only when secretions are present. B. Position the client upright during meals. C. Limit oral intake to decrease aspiration risk. D. Delay oral hygiene to avoid gag reflex. Answer. B. Position the client upright during meals. 16. How should activity be managed for a client with severe emphysema? A. Encourage the client to talk continuously. B. Provide rest periods between activities. C. Place the client in supine position for comfort. D. Administer high-dose opioids for sedation. Answer. B. Provide rest periods between activities. 17. What is the most critical equipment to have at the bedside for a client with a new tracheostomy? A. Remove the tracheostomy tube if blocked. B. Keep a replacement tracheostomy tube at the bedside. C. Use sterile technique for tracheostomy care. D. Inflate the cuff to the highest pressure possible. Answer. B. Keep a replacement tracheostomy tube at the bedside. 18. What is the immediate nursing action for suspected tension pneumothorax? A. Insert the chest tube at the bedside immediately. B. Prepare the client for needle decompression. C. Apply oxygen and monitor the client closely. D. Elevate the head of the bed and auscultate lung sounds. Answer. B. Prepare the client for needle decompression. 19. A client's oxygen saturation drops to 82% despite oxygen at 2 liters per minute. What is the priority action? A. Increase oxygen to 10 liters per minute without provider's order. B. Contact the provider immediately. C. Turn off the oxygen and assess pulse. D. Wait 30 minutes to see if saturation improves. Answer. B. Contact the provider immediately. 20. When preparing to suction a client, which step ensures safety and effectiveness? A. Apply suction for 20 seconds continuously. B. Lubricate the suction catheter with sterile saline. C. Perform suctioning only after meals. D. Insert the catheter without wearing gloves. Answer. B. Lubricate the suction catheter with sterile saline. 21. What assessment finding requires immediate intervention in a client receiving a nebulized bronchodilator treatment? A. Productive cough. B. Mild tachycardia. C. Fine crackles. D. New onset of wheezing. Answer. D. New onset of wheezing. 22. Which dietary change is most appropriate for a client with COPD? A. High carbohydrate meals. B. High protein, small frequent meals. C. Low fat, large evening meals. D. Low sodium snacks throughout the day. Answer: B. High protein, small frequent meals. 23. What is a primary goal in teaching a client with asthma about peak flow monitoring? A. Measure oxygen levels during sleep. B. Detect early signs of airway narrowing. C. Replace daily spirometry tests. D. Reduce the need for rescue inhalers. Answer: B. Detect early signs of airway narrowing. 24. What action should a nurse take after a thoracentesis? A. Place the client flat with the head down. B. Monitor for signs of pneumothorax. C. Encourage deep coughing every hour. D. Restrict fluids for 8 hours post-procedure. Answer: B. Monitor for signs of pneumothorax. 25. What client report requires immediate attention after chest tube placement? A. Mild discomfort at insertion site. B. Continuous bubbling in suction chamber. C. Sudden shortness of breath. D. Drainage of 80 milliliters over 4 hours. Answer: C. Sudden shortness of breath. 26. In which position should the nurse place a client with advanced COPD to maximize breathing? A. Supine with legs elevated. B. High Fowlers with arms supported. C. Prone with arms at sides. D. Lying on left side with knees flexed. Answer: B. High Fowlers with arms supported. 27. What is the correct nursing action for a client using a metered-dose inhaler with no spacer? A. Inhale quickly and hold for 2 seconds. B. Exhale fully and press inhaler while inhaling slowly. C. Take 5 rapid puffs for full dose. D. Breathe in through the nose while pressing the inhaler. Answer: B. Exhale fully and press inhaler while inhaling slowly. 28. What is the nurse's priority when caring for a client with newly diagnosed tuberculosis? A. Teach proper inhaler technique. B. Encourage fluid intake. C. Initiate airborne isolation precautions. D. Prepare the client for bronchoscopy. Answer: C. Initiate airborne isolation precautions. 29. What is the best time to collect a sputum specimen for culture? A. Before bedtime. B. After meals. C. First thing in the morning. D. Immediately after antibiotic administration. Answer: C. First thing in the morning. 30. What finding requires immediate action during a respiratory assessment? ARR of 22 breaths/min in a post-op client. B. Bilateral wheezing in an asthma client. C. Use of accessory muscles in breathing. D. Clear breath sounds with productive cough. Answer: C. Use of accessory muscles in breathing. 31. What client behavior indicates effective use of an incentive spirometer? A. Blowing forcefully into the mouthpiece. B. Exhaling quickly before inhaling. C. Inhaling slowly and steadily to raise the indicator. D. Using the device once a day. Answer: C. Inhaling slowly and steadily to raise the indicator. 32. What is the nurse's priority action for a client with respiratory acidosis? A. Administer intravenous bicarbonate. B. Increase ventilator rate per protocol. C. Restrict fluids and sodium. D. Give a bronchodilator via nebulizer. Answer: B. Increase ventilator rate per protocol. 33. What clinical sign is most concerning in a client with pulmonary embolism? A. Chest pain relieved by rest. B. Warm, dry skin. C. Sudden shortness of breath. D. Bradycardia. Answer: C. Sudden shortness of breath. 34. What is the best action when a client with emphysema is excessively drowsy on oxygen at 4 liters per minute? A. Discontinue the oxygen immediately. B. Notify the provider and decrease oxygen to 2 liters per minute. C. Instruct the client to deep breathe more frequently. D. Increase the oxygen to 6 liters per minute. Answer. B. Notify the provider and decrease oxygen to 2 liters per minute. 35. What task can be safely delegated to a UAP for a client with pneumonia? A. Educate on use of incentive spirometry. B. Measure and record oxygen saturation. C. Adjust oxygen flow to maintain SpO2 levels. D. Assess lung sounds for improvement. Answer. B. Measure and record oxygen saturation. 36. What does pursed lip breathing help prevent in a client with COPD? A. Air trapping. B. Hypoventilation. C. Bronchospasm. D. Tachypnea. Answer. A. Air trapping. 37. What is the purpose of chest physiotherapy in clients with pneumonia? A. Dilate airways. B. Suppress dry cough. C. Loosen secretions. D. Reduce fever. Answer. C. Loosen secretions. 38. Which sign suggests a client with asthma is worsening? A. Productive cough with yellow sputum. B. Increasing need for short-acting beta agonists. C. Pulse rate of 90 BPM after exercise. D. SpO2 of 95% after activity. Answer. B. Increasing need for short-acting beta agonists. 39. When should a nurse hold a scheduled dose of a bronchodilator? A. If heart rate is below 60 BPM. B. If client reports headache. C. If respiratory rate is below 12 per minute. D. If heart rate is above 120 BPM. Answer. D. If heart rate is above 120 BPM. 40. What is the priority nursing diagnosis for a client with COPD? A. Impaired physical mobility. B. Risk for imbalanced nutrition. C. Ineffective airway clearance. D. Disturbed body image. Answer. C. Ineffective airway clearance. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.